All right, well, welcome everyone to this week's edition of It's Worth a Shot. This week we'll be discussing our Worth a Shot series and looking back over this last year and highlighting some of those resources and sharing some of those resources back forward. My name is Jessie Kinsey and I'm an account manager with Mountain Pacific, and today is February 1st, 2023. Next slide, please. So we have a few updates to kind of kick off our series for this week, one of which is the National Healthcare Safety Network, NHSN, Frequently Asked Questions Guide that we recently developed and launched. I just wanted to bring this up to everybody, and I will drop a link for it in the chat. This guide was developed specifically for nursing homes to help with some of those more frequently asked questions and kind of troubleshooting items that continue to come up. I know that resetting passwords has been a big thing. I know the questions come up. What if you no longer have an administrator at the facility? How do you gain access? And this guide addresses those questions. And I just dropped that in the chat box for everyone to reference. And it's also located on our website. And then I also have another item I wanted to share with you that was just identified today and shared out on our regional listserv. And I will drop that in the chat box as well. This is a free 4-part training module around strategy to improve vaccine uptake, patient safety, and staff well-being. And it consists of 4, again, free training modules, and they touch upon trust, logic, empathy, and authenticity. And I'll drop that link in there for you too. All right, so those are quick updates. Next slide, please. All right, as usual, feel free to add any webinar topics or clinician ideas into the chat box, and we will continue to meet every Wednesday. And this week's polling question: does your medical provider recommend the COVID-19 vaccine to their residents? Yes or no? And I'll just give you guys a few moments to respond. See if we can break 20. How's that? One more person. Again, polling question: does your medical provider recommend the COVID-19 vaccine to their residents? There we go. There's 20. 21. Thanks, guys, for participating. It looks like a majority of folks responded yes, and there is a small number that responded no. Well, thank you guys, as always, for participating in those. We'll close that poll out. And next slide, please. All right. It looks like this is the most favorable graph we have seen in quite some time. Our influenza rates continue to be on the decline, although immunization is flu immunization is continued to be recommended, as there is still some outbreaks in areas. And we are hearing of some unfortunate cases in some long-term care centers where they're going through noro, turnaround, and going through flu and COVID. So best possible scenario is to try to get those residents vaccinated. But this is a wonderful news to see that we're still on that decline. And next slide, please. Weekly COVID-19 snapshot. Here's some favorable numbers. Once again, cases are on the decline. Deaths, we're still seeing some inconsistent data. Hospitalizations is on the decline. Vaccinations, we are seeing a small increase in those that have received the updated booster. I believe this was 15.3% prior, so small increase, and we'll take it, continuing to encourage vaccinations as the best line of protection against severe illness and hospitalization. And with that, there is a new graph and data summary that has come out that I think all of us have been waiting for. So I'm going to try to screen share and show you that, Mary. Thanks, Mary. Well, darn, I wonder if it won't. Let's try this.
Jesse, I have it pulled up if you'd like me to share it.
Oh, I just got it. I think it's going to work. Thanks, Miranda. Can you guys see it?
Yep, we sure can.
Okay, so I just wanted to take the opportunity on this call. It was so timely. This was just produced, rates of COVID-19 deaths by vaccination status. We had a hard time tracking this down and looking at the statistic and having something visual to share forward with our staff, our residents, our families, and our long-term care settings. And we finally have it. So as you can see, the graph speaks volumes. You look at the 12.7 times lower risk of dying from COVID-19 compared to unvaccinated staff, and the 2.4 times lower risk of dying from COVID-19 compared to people with the updated bivalent. And when you look at this graph, that black line up here is unvaccinated. This blue are those that have the primary, and then the green is that have received the updated booster. So again, I wanted to share that with you guys, and I'll drop that in chat for you too. I know a lot of us have been looking at it and wanted to see where's the facts, where's the data, and it's finally before us. So gotta love that. So thanks, Mary. You can go back to the slides. All right, so with that, next slide, please. I'm going to pass off the beginning of our presentation this week as we reflect back on our Worth a Shot series and resources to my colleague, Kyla Newland in Alaska.
Thank you so much, Jesse. So recently, we were asked to present to a group of our peers in the quality improvement organizations on a national call about this series. And so we decided that we would want to celebrate with you all as well and kind of share some of the information about how we developed this series and how many sessions we've held, etc. So if you want to go to the next slide, Mary. These numbers are a little bit higher now than they were when we put these slide sets together. So our total number of sessions is, I think, probably 53 or 54 now. We've had over 3,000 participants at this point, and our average of 57 participants each week. So the goal of these when we started 54, okay, thank you, Miranda, was to keep these short and sweet, but really be able to provide the best information for all of you folks as you're out there on the front lines. And then in addition to that, as many of you know, and we've interacted with many of you and asked you to present for us on this call to share with your peers, because you're the folks that are out there on the front lines and being able to share things that are happening in your communities. So we did a mix of subject matter experts, updates on COVID, vaccines, general survey guidance, but we also put in there a lot of guest speakers. Actually, about 50% of our sessions have had a guest speaker, someone that is actually in a center or folks from the state to give us information. So we also incorporated into our topics beyond just COVID, things like burnout and just general wellness for folks as we move through the pandemic and kind of see how it has affected just everyone in healthcare overall. We can go to the next slide. So a couple of the strategies that we've used, as you've noticed, we do weekly polling questions, as well as soliciting feedback from our audience on what topics you would like to hear about and what questions you might have. Also, having a kind of active Q&A that is evolving every week. And I believe Jessie sends that out with her reminders of this call. And that's just basically a rolling log of all the questions that we've received on these calls and the answers. So it's like a frequently asked questions document, but it's pretty extensive because it's spanned the entire length of our series. So the way that we plan these sessions is after these sessions every week, we will meet as a team and decide, we usually have topics planned out for the next several months, but based on things that are rapidly evolving with COVID vaccine recommendations, testing recommendations, et cetera, we're able to pivot topics and really try to get the most timely information to you on a weekly basis, but also keep it to this 30-minute time frame so that we can be, we value your time so much. And we just are so happy that we've had such great engagement with you and been able to be supportive. And I was actually invited to join this group, and it's been a real pleasure because I hadn't worked previously with nursing homes or centers, and it's really been nice to get to know some of the folks on this call across the region as well as in Alaska. So I think I will turn it over to Jessie now. She's going to talk about some of the strategies we use to collect data.
Perfect. Next slide, please. And just like what Kyla had mentioned, we are trying to identify, you know, what's important to you guys, and you know, how can we partner in bringing that information forward and identifying those partners that may be willing to speak. So anyone on the phone, I always reach out and would love to invite any one of you guys to be a guest on our weekly presentations. I know there's a few of you listening that have been, and we sure appreciate you. And I think it's valuable to hear from each other so that you can best practice share and know that you're not in some of these circumstances alone. And also that you don't necessarily always have to reinvent the wheel. So there may be a problem you're facing that your peer 2 counties over already faced, and they may have a solution they're willing to share. So really pulling all those players together and listening to you guys, we've been able to also help support resources and grow a library of tools and share those tools out and put those online. So next slide, please. So I will say that, you know, those polling questions in the beginning of our presentation, they have really helped to see where we need to develop education. And we also do that post-presentation evaluation, and always appreciate your feedback on there. I look at those. I go to the very last line and see what the comments are. We want to make sure that we maintain engagement going into this new year, into 2023, that we're bringing what you guys want to hear forward. And ultimately, by keeping a pulse on all those moving parts and listening to our feedback and suggestions, that's how we're continuing to evolve that resource library and identify where we can expand that library and content and add additional education and resources, and where there may need to be a lot more help. And we also have recently developed It's Worth a Thought. It's really spanned from this It's spanned from this weekly Worth a Shot series, and you may have seen that hit your inbox last week. It's Worth a Thought. It's a monthly touch point that was a spin-off of this weekly series for providers and it has healthcare resources and tools, and it was really, again, developed to be an additional resource. So again, lots of great information, and it's all based on your feedback and participation. Next slide, please. So the impact, we have been able to reflect back on the last year and identify common conversations and challenges and barriers, and we report those forward so that we're trying to identify education, improve outcomes, and collaborate with state partners and stakeholders. And when we have a chance to visit with key players, we're sharing forward concerns and helping to try to problem solve and help grow that conversation. And again, through this weekly series, I feel like we've been able to really create a greater collaboration with a lot of our community partners. So, one thing that we've identified just through this call, I will say, is, it's no surprise we're really going through a lot of staff turnover in our buildings. No big surprise, right? Everyone is struggling with this. And the identifying that there's new players in new roles, and that specifically new IPs, new infection preventionists trying to do their jobs. We identify that. So what can we do as great partners? What information can we bring forward? Again, trying to keep this series specifically to 30 minutes. Can we help with a quick checklist for IPs? Can we help with a 10-minute in-service on barrier precautions? And I hope that by bringing those topics forward, that has helped you on your side. And, again, that's helped grow our library too. Next slide, please. All right, so this is kind of fun to look back in 2022 and reflect on our vaccine rate and how it ties into our partnerships and collaboration with all of you that are on the line, and then some, between all of our communities. And in 22, we started this series back in January, and it grew, it transformed, and we tried to, be adaptable. And in 22 alone, we hosted over 49 webinars, and again, over 30 guest speakers, and produced a multitude of different resources solely based on the feedback of these webinars. And although our vaccination rates, our metric is constantly changing as far as how we look at booster rates and rates of improvement, but we saw a significant improvement that we could correlate with the education that we shared forward, education that perhaps you shared with your families, your staff members, your residents, maybe even your providers. And we'd like to say that was a win, and definitely a win for the year, and that we were helping support you. Yeah, next slide, please. So with that, I just wanted to take a few moments to highlight some of our top picks of resources that kind of spun from our educational efforts. And then we'll have some time for some questions, or maybe if you want to share some of your favorite resources. We wanted to highlight the top 10 guide to bivalent vaccine. It's available on our website. The COVID-19 data dashboard. If you haven't had a chance to check that out, the link is on our website as well, and we can drop that into the chat. And that essentially is a template in which you can put in your own information for your facility. And it kind of tells a story as far as outbreak information, vaccination rates for your staff, vaccination rates for your residents, and then your community levels. And it's unique to your facility. So you're not relying on maybe more generalized national data. You can actually generate data that has your facility's specific story. We also created a COVID-19 vaccine guide, a general COVID-19 guide to help mitigate or navigate through compliance and general guidance. And then we also created a COVID-19 vaccine clinic fillable flyer that is online too. And it, let's see if I can snag that link for you guys. It is a flyer that you can post to correspond with the days in which you're going to have a vaccine clinic, so that there's kind of a more advertisement per se, and awareness that you have an upcoming clinic, and maybe to help increase vaccination rates there, just by folks knowing the convenience of when it'll be. And then last but not least, we also have created an infection prevention guide, really identifying where new individuals, or maybe some seasoned, would benefit from having something in all in one place, as far as training and friendly reminders, who to reach out to, common tips, and kind of a variety of guidance within that prevention guide. So again, just wanted to take a few moments and highlight some of the resources that have spawned from this weekly series, and we can't thank you guys enough. Next slide, please. So with that, any questions? Any favorites? And we did drop all those links in the chat box if you wanted to snag those, and they are available on our website as well. Just double check in the chat. I don't see any questions. Again, Kyla and I thought we would take a moment and kind of reflect on last year and the series, and how grateful we are for you as the audience. So we welcome your feedback, and we look forward to the new year. Kyla, you have anything to add?
No, I would just like to echo that as well. We were sharing with our national peers, I guess, and it's like, well, we need to reflect with the folks that are really engaging with us and that have really been involved in our work the last year and a half.
Right.
This is Miranda, not to put anybody in the spot, but if maybe Larissa or Emily want to talk about It's Worth a Thought, the news of the e-blast that went out, and see if people might be interested in having that in the nursing home world, because I know it is more community based.
Sure, it's actually really designed to be a very almost like greeting card style touch point that provides a provider facing resource and a patient facing resource that's printable for organizations. Can be, this first one was on chronic disease management. It was the updates on diabetes standards of care that came out, and then a tool for diabetes management. So we plan to continue to distribute those monthly, and the topics will range from opioid use, chronic disease, care transitions, anything like that. So just a little something to brighten everybody's day, and trying to keep it very minimalistic to a very pertinent update and resource for you all.
Thanks, Emily. All right. Well, I suppose, and I am so sorry.
I have something, Jesse. It's Jill with Mountain Pacific, and I just had an email from a nursing home provider in Wyoming, asking if anyone has had any trouble logging into NHSN today. They keep trying and they just say it keeps buffering or spinning. So Oh, okay. So Holly, it looks like you've had some trouble too. Thank you. It's just helpful to know if it's, like whose end is this on, right? Is it the nursing homes? Is it something going on with NHSN? Okay, folks. Gosh, that's great I'm sorry for the hassle. That's not good news, but it is helpful to know that it's not just this one provider. So thank you. All right, well, I can close this up. So I'm happy to, looks like, thanks, Holly. I'm happy to wrap us up today. And again, thank you very much for your participation. If you're new to us, welcome, and hope to see you next week. Have a great rest of your Wednesday. And don't forget to complete the evaluation. That's very helpful for us.
Thank you, everybody.
Bye.